Okay, so we are live. Hey, Supernaturals. It is your host, Beverly Hines, also the founder and CEO of Hair Scripts, the platform that is connecting you with hair loss problems to dermatologists and trichologists for treatment and support. So I'm really excited about our guest today, Mr. Iain Sallis. He is from the UK, our very first, probably not, actually UK guest. So let me just give you a little synopsis about him before we jump into today's topic. So Iain Sallis is a trichologist from the UK. He's founder of Hair Medic Limited. He has 11 clinics throughout England. He has high quality hair products that will be launching very soon. And he is the co-founder of the Trichology Professional Development Program. So, Iain Sallis, before we get into the topic, which is why you should understand the science behind hair growth and hair loss, I want you to tell the Supernaturals a little bit about yourself, your journey. How much years of experience do you have and what led you down this path?
Okay, thank you for having me. I appreciate the time, the opportunity to talk. I've been a trichologist for nearly 20 years now. And I was a hairdresser before that. So I've been in the hair business for quite a long time. And as I was transitioning between hairdresser and trichologist, and the reason why I came into trichology is because I was at a very high-end hairdressers, and they really knew their stuff about hair cutting and coloring and things, but nobody knew very much about hair science, and nobody knew about why hair was growing or why it was doing the things that it did. So it sort of led me on a path towards trichology and being able to understand hair and scalp and hair loss more. I was trained at the Institute of Trichologists, and that is one of the oldest establishments for trichology in the world. It was nearly 120 years old. But what I found is that trichology and trichologists are usually very not undereducated or underqualified, but there is the qualification system that we have is unregulated, and the area that we live in as trichologists is there's no standards, there's no regulation, and there's very few official qualifications to benchmark where trichologists are. So what we've been doing over the past few years is creating a education pathway to a higher degree level and push that professionalism in trichology further than what it has been or what it is at the moment. So that's where my passion lies at the moment, is getting trichologists to be relevant and standardized and regulated so they're safe and effective for the public.
That is awesome. It seems like you have this core thread, which is education, and you like to teach, which leads us into today's topic. So I want to reel you guys in and explain to you why today's topic is very important and relevant to you. It's, even if you're not a science person and you don't geek out on all this stuff, have you been trying everything that you found, whether it's products that you buy, whether it's, DIY treatments that you've seen online, YouTube, or maybe even heard from here, and it's still not working for you, and you've obviously tried, you've given it a long-term try? Well, this is why this is important, because understanding the science behind hair growth and hair loss is going to hopefully help you with understanding how to start your journey towards hair growth. So let's talk about that. How does understanding hair growth help us actually grow hair? How does that?
Well, everything starts from a diagnosis. And the problem is that as hair loss sufferers, I assume that the people that are listening to this are interested in hair and hair growth and hair loss. It's really important to understand that hair loss isn't like a headache or a broken leg. It's not a thing in itself. So when you say, I'm suffering from hair loss, and then somebody goes, oh, I know something, here's something that can help, and they give you whatever it is that they've got on the shelf, then that's the wrong way of looking at it, because what hair loss is a symptom. It always is a symptom. So what you've got to do to correct that is find out what is a symptom of. Now, that shampoo or that product that you've got off the shelf has a very, very limited range of what it's going to affect. So you're shooting in the dark of whether that thing that is in that tablet or in that product is the thing that your body needs to correct the problem. So first of all, what you need to do is go to somebody who knows what they're talking about hair loss, and then they will do investigations. And in my clinics, I actually don't provide any treatments, as stupid as that sounds.
Really?
I know, no. What I am is I'm an investigator. Somebody comes in and they go, I've got this problem, and I go, right, these are the, and it's like an algorithm. So this is the pattern that you're suffering from. These are the things that it could be. Let's do a set of blood tests or relevant tests for that. Then we get the blood tests back, and then we come to a preliminary diagnosis. And then if it's a serious issue, such as metabolic or hormonal, we'll get the doctor, the GP, what we call a GP in this country, a general practitioner, involved, and we'll go, dear doctor, your patient is suffering from X. This is causing her hair to thin, and therefore this needs to be corrected. Yours sincerely, Iain Sallis. So they'll go on a regime, which is usually a medically based regime, and then you start seeing differences. Now, that's one pathway. The other pathway is that they come back and they go, well, the problem is that you're low in iron. So we go, right, we'll put you on a course of iron tablets for 3, 6, 9 months. Keep on retesting and make sure that the iron level gets to a certain therapeutic level, at which point we're able to see differences. So that's another way. But we don't just go, oh, you're going to be low in nutrition, or you're going to be low in something without testing it, because otherwise your body's not going to respond. So that's basically what I do. I figure out problems and then get other people to deal with them if they're medical, or I can deal with them if they are subclinical.
Almost like you're a liaison or a curator, and you're kind of leading and directing people to the people that they need to connect with. So
it's exactly what a trichologist should be.
What it should be.
Yes.
I caught that.
Yes. So trichologists can be therapy based. So, and some of those places, and I've got colleagues in America, and you'll go into a trichology clinic and you'll see banks and banks of laser therapy helmets and things like that, which is fine, because those treatments, some of them have had clinical data to show that they stimulate hair growth. Big thumbs up. That's great. Low level light therapy, minoxidil, all those clinically based or scientifically based therapies have a place, most definitely. But first of all, you've got to figure out what the problem is, and then say, well, okay, so you might be low in iron, or it might be genetic thinning. So there's problems which can be corrected and problems that can be treated, because you can't correct the underlying issue. So genetic hair loss is by far the most common problem with males and females. So in that case, you would talk to them about, after eliminating all the other underlying issues, then you go on to treatments and go, right, we've done everything that we can holistically, naturally, therapeutically for the body to grow hair. That isn't working, or it's only partially working. What treatments can we now use to stimulate hair growth further? Right. Usually that's minoxidil or finasteride, because those are the medically proven treatments. But then you put adjunct therapies into that, such as low-level light therapy or PRP or mesotherapy and these types of things. But what you shouldn't do is, you shouldn't go into a trichology clinic and they stick you under one of those treatment regimes without doing any tests, without understanding what the underlying problem is, and with a big promise that your hair will grow back. Because even if it does, you are beholden to that treatment, because if it's genetic hair loss, you're beholden to the treatment that you go on to and what stimulates hair. Because if you take away that treatment, the therapeutic effect goes and your hair then starts naturally thinning again.
Wow. So if you remove the treatment, then you're saying it's going to basically relapse and go back.
In genetic hair loss, yes.
In genetic hair loss. So it's almost like when you sign up for treatment, you have to understand that it's going to be long-term.
Well, before you stand up for treatment, you need a diagnosis.
Right. Right. So I want you to talk to the person who can't necessarily afford the trichologist, right? Who can't pay out of pocket. Um, Give them a first step. Who should be the first person that they see if they have to do this by themselves and they don't have a liaison like yourself?
Okay, so yeah, I mean that's a very good question, and obviously trichologists can be expensive, and treatments can be expensive, and you've really got to be wary about people like me, even me. I always be cynical when it comes to people talking about treatments. So the first port of call is your doctor, your family doctor. Um, Sometimes doctors are not very good with hair loss, unfortunately, and I think this is one of the reasons why people look further than their doctors and they start reaching for the lotions and potions and all these wild and wonderful things, is because doctors go, nah, it's hair loss. Doctors are really good at illnesses. They're not particularly good at wellnesses. So the doctors are really going to make sure that you're not going to die from anything. That's their number one thing in their mind. Are you really ill? And if you're not really ill, they'll go, well, you don't need to see me. See you later. And the problem is that the hair is an incredibly sensitive set of cells. Do you know that you grow 2 meters of hair per week?
No, I know now because you're telling us about the science.
Yes. Yes. So usually people grow about 12 kilometers of hair per year. That's a ridiculous amount of energy to put into something which we don't particularly need. And therefore, when something happens to the body, whether it is a shock or an upsetment, or whether there is a lowered level of a nutritional level, or if there is a metabolic reason like thyroid problems, the first thing to be affected are these hair cells, which are incredibly fast dividing. They're a secondary tissue, so it's way down on the list of things that the body needs. So the body will naturally balance its own resources, and it will always be against hair. So you need optimum levels of lots of things to make sure that your hair grows well. So going back to your doctor, you go, doctor, my hair is gradually thinning. Now that might be due to thyroid, nutrition, genetics. So he will probably go through the most obvious reasons for a person losing their hair. So that is usually, do you have hypothyroidism? Are you anemic? Do you have a hormonal problem if you're a female? So yeah, if he sort of goes through those things and sort of there's a tick box, you haven't got anemia, you're not hypothyroid, and there is no signs of anything like polycystic ovary syndrome, he'll usually kick you out the door and go, it's one of those things. See you later.
Right.
So when it comes to iron, a couple of quick fixes is that you need a ferritin level over 100 usually to actually increase hair density. Your thyroid, you've got to make sure that you've got a thyroid antibody test, because you've got to rule out Hashimoto's disease, which is usually a lot more common than hypothyroidism. And make sure that you're not on any contraceptive pills or contraceptive devices that increase the testosterone or progesterone in the body, because that also can affect the hair cycle.
Can you pause there for a second and let's talk about the contraception, because we've kind of touched on it a little bit. We glazed over it, but I just want to go in depth. How does that affect the anagen cycle, especially? And you said you specifically highlighted progesterone.
There's a specific version of progestogens, which can be. What happens is when you start taking a contraceptive pill, then it starts disrupting your natural cycle, and it starts increasing the testosterone and the estrogen in the body, or starts changing the testosterone and estrogen levels in the body. If you are genetically sensitive, so it's not everybody, but there is a particular effect that can cause the hair cycle, the anagen phase, to shorten because it's been drip fed that progestogen. Usually we see that in people that have the more longer term contraceptive devices, so implants, injections, the marina coil in. I don't know whether the marina coil is a thing in the US,
Yeah, you
but
do.
we have that in. So anything which has that really long-term effect can have the ability to increase your hair shedding by decreasing the cycle. So what tends to happen is your hair is 4D. There's length, breadth, width, and time attached to it.
Oh,
And when the time shortens, when it isn't allowed to grow for as long as it needs to, which is usually about 3 to 4 years, depending on the person, then if you remove the time, you remove the length. So, and when you remove the length, the hair doesn't bulk up. It doesn't get all nice and thick at the bottom and the ponytail. So you usually find that if there is a thinning problem, it's to do with a cycle disruption. And so you have to work backwards of what that is. And part of that is contraceptive pills or contraceptive devices and eliminating those issues.
So I want to go a little more in depth. So you said long term. So one question is, if someone stops contraception, will they start to see an improvement? And obviously not right away, but will they start to see improvement if they stop using contraception?
Well, it depends.
Contraceptive pills. Mm-hmm.
Yeah, it depends, because if the hair growth, if the contraceptive pill has had a severe effect and it's drip fed those androgens into the body and you're genetically predisposed, that means as your hair has grown, died, fallen out, come back again, it may have miniaturized. And that miniaturization process will not reverse on its own. So, but there is a potential that it hasn't miniaturized and it is just affecting the cycle itself, and therefore it'll grow back normally. So again, you've got to sort of eliminate these things.
And it's so hard to do all of this by yourself, honestly.
Absolutely, absolutely. So, and you've got to watch and wait, and you've got, and time's a factor here. Here's another thing that people tend to disregard or not understand, especially doctors. The hair that dies today will fall out in June. The hair that you brush and comes out in the brush today, that died in December.
Wow.
So there's a 3-month time lag. So if you think that somebody sitting in front of me has got a problem, and then I can go, right, I'm going to click my fingers and correct your hair cycle, you're not going to see any difference until June, because the hair which dies today is still going to fall out. It's the only the hair bulbs which are cycling through and creating those hair cells which have been corrected, not the hair which is in the shedding phase. So to correct a hair problem takes about 6 to 9 months to see differences.
6 to 9 months. So let's talk about the hair growth cycle. Let's break it down for anyone who doesn't know exactly what the cycle is and how it works, and then how can we work with the hair growth cycle, if we can.
Okay, so the basic model is growing, dying, shedding, and growing again. Now, the growth cycle, the growth phase is called anagen, and that's usually for about 3 years. The dying phase is a really clumsy term because your hair doesn't die. The hair bulb goes to sleep and detaches what it's made from itself. So it should be called the sleeping phase, where it isn't. But the dying phase is called catagen, and that's a transitional phase between the hair bulb going to sleep and then waking up again about 6 weeks later. In the process, the hair starts being ejected from the follicle, and that takes 3 months, and that's called the telogen phase, or shedding phase. Now, to make things really, really complicated, because obviously hair is complicated, there is something called an exogen phase. Now, exogen is the point where your hair falls out, not the shedding. So
what's the difference?
Well, telogen is the shedding phase, not the falling out phase. Exogen is the bit where it falls out. So when people start using things like minoxidil and they go, oh, there's a lot of shedding, all my hair is falling, because minoxidil, one of the side effects is something called the dread shed, and people do tend to see a lot of hair fall out. What we think happens is that it affects the collagen in the scalp, and it sort of relaxes the opening of the follicle, and all those hairs which were going to be trapped in that exogen phase for a couple of months, and then it falls out, then it just gets released altogether. So there's that. And then there is something called a kenogen stage, and that is a dormancy stage. So instead of the hair growing, dying, falling out, and coming back straight away, if it goes to sleep for a bit, and this is what tends to happen with female pattern hair loss, then it's called kenogen. And what minoxidil, again, is very good at doing is re-stimulating those follicles from a kenogen phase. So it wakes those follicles up and starts growing hair again. Whereas with long-term female pattern hair loss, those can become more and more dormant, and the kenogen phase gets longer and longer and longer. Does that make things easy for you?
It makes it, listen, it makes it easier for us because you're breaking down the science. And I was going to ask a quick question about how do we work with the hair growth cycle, but I do have a quick question. Give me 1 second. Hold on. Because I lost my train of thought. Not the phases. Hold on. It'll come back to me. I'm sorry.
Okay.
It'll come back to me. How do we work with the growth cycle?
Right. So when you suffer from nutritional issues or hormone issues or even metabolic problems, usually what happens is the growth phase shortens, and then the shedding phase and the dormancy phase lengthens. And that's what it usually all boils down to. So to increase the hair cycle again, you've got to figure out what the underlying issue is, which is shortening the cycle. Now, going back onto therapies, minoxidil artificially extends the life of your hair. So it extends the anagen phase.
So let me interject really quickly. Minoxidil, just really quickly for my audience listening, is it safe for women in childbearing age?
Officially, I believe that there has been no, there's no evidence to say it crosses the placenta. However, I think that the official guidance is that you don't use it during pregnancy.
Okay.
So what you could use as an alternative, again, is low-level light therapy, because that has been shown to have no side effects whatsoever. And that uses something called photobiomodulation. So what that is when your cells of your body are stimulated by rays of light, different rays of light. Now, if you've ever been on holiday and you've been in a really sunny climate, and this is probably to the people that are sort of in dark, dingy areas like the UK. We go on holiday and all of a sudden our nails start growing quickly, and you can feel that your hair's grown over that nice two-week period. You come back with a mop of hair and go, I need another haircut. And that's the reason why, is because a wavelength of sunlight has penetrated our skin, and it's increased the cellular turnover of your nails or your hair or your skin. That doesn't last for long, because obviously we tan, the body protects itself. But light therapy has been known to stimulate cells quite considerably over the body.
Right.
So what that does is it speeds the cycle up. So people with that are concerned about using things to stimulate their cycle, and they can't use medication, then low-level light therapy is very good. But a caveat to that, I've got to say this, and that is that the things that you can buy off the internet, the Hair Max laser combs and all that type of thing, they're just as good as the things that you see in the clinics. You don't have to go to these clinics to actually get the wavelengths.
You're telling us that. Are you giving us all that good information?
It's one of these secrets, but not secrets. They're all exactly the same wavelength of light, about 650 nanometers. Now, what you're buying is ease of use. So
Okay.
you sit under one of these things and it'll shine a light rather than getting a comb or something and moving it around your head. Now, those what tends to be stimulated by these wavelengths of light are called the mitochondria, which are the batteries of your cells. Now, those can only absorb so much energy all at once. So whether it's like a sponge, and whether you drop a sponge into a bathtub or a swimming pool, it will absorb the same amount of water.
Right.
So these places that go, we've got a super powerful machine and that will be better for you. It won't. Just do yourself a favor. It is helpful, those types of things, but get one off the internet. It's cheaper.
Thank you for that. So I want you to go back.
So there's going to be a lot of people that are going to be
that's going to go on the internet and get those light therapies and those combs. That's going to help. Now, he mentioned that that's an alternative. Obviously, if you don't want to use medication, if you're in childbearing age or pregnant, etc., for minoxidil, but the mechanism of action is completely different. So you were talking about the anagen, working with the anagen phase and minoxidil. So for those of you who are still open to using minoxidil, you've had all your kids and you're like, I'm done. I just want to fix my hair. Continue. What can they do?
Well, so treatments, like I said, first of all, rule out, or if you can, rule out all the other deciding factors before you start long-term treatment. If you've got your blood tests, if you're as healthy as you possibly can be, if your lifestyle is good, if you are, you're not a smoker, you're not massively overweight, because obesity does tend to affect hair as well as smoking. So you've got to get those health and well-being.
Or a social drinker.
Actually, drinking is okay for hair, fortunately.
Right? Okay. So if you're grown and sexy, you can stay grown and sexy while you're on minoxidil, okay? Go ahead.
Absolutely. So your hair is just a set of cells like the rest of your body, and your body reacts as a whole. Your hair doesn't just act of its own accord. So if you are ill, or if you are not particularly well, then your cells in your hair will be affected as the rest of you are. So make sure you're as healthy as possible.
Okay.
So we've ruled all that out, and we want to start using a treatment. So minoxidil is a very regain or Rogaine, which is the American equivalent.
Right.
It's usually the go-to treatment for genetic forms of thinning for women, and they have to use it for about 6 months. They have to use it consistently. It's usually just on the top of the scalp, and usually in about 60% of cases, then that's all that you will ever need. But it does become a bit like toothpaste. You have to carry on using it every single day to make sure that you keep your hair where it is. It's like you use toothpaste every single day. Nobody complains about using toothpaste, but people complain about using things for their hair. So if that doesn't work, then there's a reason why sometimes minoxidil doesn't work, and that's something called a sulfotransferase. Now, sulfotransferase is this little enzyme that lives in our skin, and some people have lots of it and some people don't. And we want minoxidil to turn into a catalyzed version called minoxidil sulfate.
Okay.
And that happens through that transferase pathway. So the people that don't have significant effects, they have very low levels of this transferase, and therefore they need a different type of medication to help. Now, there are different medications to help. You can use, there's people that prescribe oral minoxidil, so your liver is doing the enzyme work rather than your skin.
Yeah.
And sometimes even finasteride can be prescribed for women, but you do need to see a dermatologist, usually, especially in this country, you do, to actually monitor those things, because at that point, oral medication has a systemic effect on your body. So you need to start, you need a physician to actually oversee that long-term medication to make sure that it's not impacting anything else on your body. Minoxidil, which you put on the scalp, that's fine. It just affects your scalp. The skin basically is a really good barrier to it. So not much gets into the body. Whereas if you're taking a tablet, everything gets into the body, and then your hair benefits from that.
Right. So it sound like you're recommending topical, but unfortunately for these people with this sulfur transferase, and we don't know who may be predisposed to it, right? Is it a genetic thing, or is it like if we're multicultural, if we're ethnic, are we more predisposed to it, or you just don't know? It's kind of one of those.
It's an interesting question, but I don't think that there's been any research on who is more susceptible. We know that there is DNA testing kits that you can do now. There is something called a trico test in this country by a product company, a pharmacy company called Fagron. I think it might be out in the US. And so you take a swab, and then you send it to a lab, and they work out your DNA pathway of your hair.
Really?
So they understand what medication will be most beneficial to you.
There's something for everything out here. What's the name of that?
Well, the company is called Fagron, Fagron. I think it's going to be launched in the US, and it's very successful. It's a very good tool as long as it's used in the right way. Again, this isn't a cure. It's another diagnostic tool that we can use.
I know some people are like, just shave it all off. I'm exhausted. I'm tired because it's a lot. So minoxidil, and because I want to transition, because you're launching your own line of products very soon, and I want to transition into that very quickly. But minoxidil right now, because I know there's so many different things, but back to what you said, considering the fact that you've ruled out every other thing and you're fairly healthy, minoxidil is a good way to kind of work with the anagen phase, correct?
Minoxidil is the number one thing that I would say to a patient that has ruled out everything else, and a female is in front of me going, I'm healthy, this is a natural age-related or genetic progression, what do I do? Before you start on those wild and wonderful therapies, before you get drawn into any treatments, before you start getting injections, before you start doing any of that, pick up the Rogaine, use it for 6 to 12 months, because it is cheap, easy, safe, and 9 times out of 10 it's effective. So before you do anything, that is the best piece of advice that I can give somebody.
That's what he can give you guys in this call. That's what he can give you guys in this podcast, because there's so much, obviously, and with the science can be broken down into so many different things. So how did you take the science of hair loss and hair growth into consideration when you were developing your products?
So this is talking to people day in, day out about hair and scalp problems. We've sort of seen niches, and we go, okay, so everybody has that problem, or a lot of people have that problem, and it needs to be fixed. And one of the things that we came across time and time again is misinformation about scalp conditions. So somebody would come into the clinic and say, I've got a really dry scalp, and I've tried everything and it doesn't work. And you look at the scalp, and they may have something like seborrheic dermatitis, which is an oily scalp condition and not a dry scalp. But because the scalp's flaking, they've been using things they've been trying to moisturize, they've been putting oils on their hair, nothing's worked. And that's because they've been feeding the yeasts and things because of the oils and the oily scalp. And what they needed is something to actually cleanse the scalp and get rid of the microbes so the scalp can calm down. You've got people that think that they have sensitive scalp issues, so they use natural products, or they use vegan products, or they try and be as gentle as possible to the scalp. When you look on the back, and they've got colorants and preservatives in, which are that sensitizing agents. So scalp problems are very, very confusing because they all more or less look the same. So we thought, can we make a product which hits all 5 categories of scalp issues? So can I make a product which is for a dry scalp, an oily scalp, a sensitive scalp, with products which are not sensitizing, and also an itchy flaky, has things which will affect microbes and get rid of the itchy flakiness? So we've done that. It took me about 5 years, and we've had a lot of We've had a lot of help from associates and cosmetic chemists that have tried very, very hard, and we've gone through trials, and it's been very successful. We've put it through hypoallergy testing, so we've got the hypoallergenic mark. It's gone through anti-dandruff testing, so we can actually officially call it an anti-dandruff shampoo. So yeah, we're very excited that we're going to launch it. And it's sort of, this is the mock-up version, so that's what it looks like.
Guys, you seeing it here, the mock-up version, and
So,
this.
there you go. So that's called hair karma, as in it's a play on words, as in it rebalances karma, and also it calms down the scalp.
There you go. You give your hair and it's going to give you what you give it, right? So talk about the scalp therapy system. Exactly what's a part of, what's all the products in that line, and what does it, how can it help overall?
It has at the moment, it's a shampoo and a condition product. Both of them are therapeutic, which means that both of them have active ingredients. Because one of the problems that we had was there was lots of therapeutic shampoos, and then they go, well, what conditioner do we use? And they go, we don't know. So these two go hand in hand, and they benefit each other if you use them both together.
So
they are
for my I need to highlight this for my audience. Can you explain why it's so important to have an active ingredient and an active ingredient in a shampoo and conditioner?
So active ingredients are the things that you can hang your claims on. Those are the things that do things, because a shampoo basically cleanses your hair and the conditioner basically coats the hair, and that's it. That is their primary function.
Right.
What you put into it then gives you the added extras. So one of the things that we're using is products for the anti-dandruff, so that gets rid of the microbes. There's also things like beta glucan, which is oats. It's an oat derivative, so that tends to help with calming the scalp down. It has products in it which are hyposeboric, which means usually that reduces the amount of oil that you produce. So it's nothing to do with degreasing the scalp with a really strong detergent. It's actually allowing the pores to slow down the production of oil. So we've been able to put all those actives into one product with a low foaming. It's a very low foaming product as well. Now that's a good thing and a bad thing. The good thing about it is, well, you don't really want foam in a shampoo. People like foam because it feels luxurious and things, but in all honesty, it doesn't do very much apart from foam. That's it. They just put it in for a cosmetic effect.
Okay.
So, and what we want is for all these actives to stay near the scalp. So you put it on and it creates like a dense cream that stays near the scalp. And yes, you can pull it down through the hair, but it will stay on the scalp primarily. So it's not going to be one of these wonderful, luxurious, amazing feeling things. It's not for that. It's not for if somebody wants a wonderful feeling shampoo, they can go somewhere else. This is for people with scalp problems and sensitivity issues. About 60% of people have sensitive skin, or they feel as though they have sensitive skin. And the scalp is the third most sensitive part of the body. So the face and the hands come first, and then it's the scalp. So we've got to start treating the scalp like we treat the skin.
Right. Right. And so talk to my ethnic Black and brown, audience who kind of shy away from actives. We usually like to stay with the clean vegan products. We also like to shy away from therapeutic products because while they're therapeutic for the scalp, they do nothing for the actual texture of our hair. Yeah,
absolutely. Now, this was designed by a good friend of mine called Dr. Henry Brew, who's from Ghana. His wife also helped it. So they, in the forefront of their mind when they was producing it, was for the Black African market as well. They made sure that this worked well with colored skin and Afro hair, which was a great benefit to me. So this, because it stays on the scalp, you can put it onto the scalp and you don't have to work it through your hair. That's a great thing. If you do work it through the hair, it's got a very, very mild detergent in it. So the cleanser part of it is super mild, so it's not going to strip the hair itself of all your oils. It's just going to feel nice and moisturized. So the problem with what I usually find with people with black hair is that they don't want to use a product which is going to be drying to the hair, and they don't want to use a product very often because it's just a pain in the backside for them. So they will oil their hair, and that means that if they've got something like seborrheic dermatitis, which is really common, then they're feeding those microbes, and then the problem gets very itchy and flaky and painful. So hopefully, if they just wanted to use the conditioner that has the same active ingredients as the shampoo, so they could still just use the conditioner, and it wouldn't actually cleanse itself, but it would still have an active to actually calm down the scalp.
Thank you so much, Iain Sallis. I mean, we went beyond time because this was a really interesting conversation. Thank you so much. Now tell the audience where they can find you and your products when it launch. Okay,
so the best place to find it is on my website, which is www.hairmedic.co.uk. So most other things that you can find on there, all the products will all be on there. We will be looking at shipping to the US at some point. And if anybody's got any ideas about how I do that, by all means, let me know, because I'm new to this as much. All I've done is gone, hey, that's a good product to make. Let's make it. And now I've got a product. I'm going, okay, how do I get it out there? So, so by all means.
Actually, 25% of our audience is in the UK. So we actually.
Oh, really? Yeah. Perfect. Well, they're fine because they can just buy it straight off the internet. So, or Amazon. It'll be on Amazon as well. Everything's on Amazon. So, yeah, thank you very much.
Thank you so much. It was a pleasure having you. Do not be a stranger to Supernaturals. And when you launch those, you should send it over to us so we can do a full review of your product.
I absolutely will do. That would be wonderful. Thank you very much for having me. I hope I've helped. If there's any questions, by all means, field them to me. I'd be happy to take any questions.
Absolutely. Thank you, Iain. Bye, Supernaturals.
Thank you. Bye-bye.